Hi everyone. In full mouth rehabilitation case for aged and geriatric patients, there is nothing like you have to place only bicortical screws, that is polysurface implants. You can place compressive implants also, that is rough surface. The main thing is here in immediate loading cases, you need to get osteofixation that needs to happen for the primary stability of the implant. So in which area which implant engages well, that you should know. For example, in the upper anterior nasal floor, my implant of choice is bicortical screws, that is BCS, engaging into the nasal floor and also in the canine region, canine fossa. When it comes to lower anteriors, again the BCS engaging well into the D2 bone, that is the base of the mandible. So in the upper posterior region, it's a D3 D4 bone. So usually the cancellous bone, spongy kind of bone near the maxillary sinus area. Place the implants in the anterior wall, in the posterior wall towards the midline through the canine fossa, angulated you can place. You get good engagement in the posterior wall of the maxillary sinus, that is tuberopterygoid, and beyond the tuberosity you can place pterygoid implant engaging into the pterygopalatine fossa. So there is a fusion zone. So in the lower posteriors, it's a tricky situation where in the presence of the IAN, that is inferior alveolar nerve. So you have to check for the position from the crest till the superior border of the IAN. Then if the length is 12 mm, 14 mm or more than that, you can place it straight. Usually here in cancellous bone, you can place compressive implants. Here you have to check for the torque. Torque should not be more than between 45 to 60 NCM. So if it's more than that, there will be compression necrosis happens and the implants may fail. So you have to be careful which implants to place in the lower posteriors. So otherwise, if there is an atrophy of the mandible, if you want to do narrow bypass, that is buccal or the lingual bypass, you can place a smaller dia BCS engaging into the base of the bone. That can be done. Then you can bend the abutment later on for the prosthetic purpose. So in that way, there is nothing like you need to place only BCS implants. So in immediate loading cases, in the one piece implantology, so I do place compressive implants also. In some cases, in full mouth rehabilitation cases, I have placed only compressive implants. With only compressive rough surface implants, I have done the full case. So many people will say that you have to place bicortical screws only since it's elastic in nature with the bone. That is true, but you can place compressive implants also. I have done many cases engaging my compressive implants in the nasal floor, lower anterior mandible, and also in the pterygoid region are placed. Okay, so main thing is you should get good stability. That is the main criteria. Then usually osteofixation and integration is going to happen. So this is the main thing. If there is an atrophy of the maxilla, transsinus polysurface implants can be placed to engage into the zygomatic bone through transsinus implants. There's through the maxillary sinus you can place, or otherwise on the walls also you can place engaging into the zygomatic bone. So here main thing what I want to emphasize here is that there is nothing like you need to complete the case in 72 hours or 100 hours, nothing like that. First place the implant properly, get good engagement, good primary stability, follow the steps. Then you finish the, since it's immediate loading, there will be bone remodeling which is going to happen. So complete the case in even between 7 to 10 days, it's not an issue. Main thing is you should get the good stability. So then your processes will be good and the patient will have good luck with their processes. Thank you.